So now I want to turn to the second one. Again, COVID, vaccines, public health. And I want to introduce Dr. Ben Sachs. Some of you who were on the webinar, I think it was this spring, maybe, Ben, when Ben gave the history of vaccines. And so Ben, if you'd like to say a few words as to your viewpoint, your background briefly, your background specifically, like for example, with the Moderna test group and what you may be bringing to the conversation on December 12th. Ben?
Yep, good afternoon, everybody. Very briefly, I'm a physician with a background in clinical medicine, public health, and health policy. Spent a year at the CDC. I have a background in administration as well. Spent 29 years at Harvard Medical School and Harvard School of Public Health. And then I was asked by the feds to go to New Orleans after Katrina to help lead the recovery of the city's health system, as well as Tulane University and the School of Medicine. Last few years, I've done a lot of international work and then settled in Sarasota, beginning of the pandemic, and I'm a professor at USF and UCF medical schools. I was vaccinated in August of 2020, subject number 34 in the vaccine trial of Moderna. And I can tell you I've donated gallons of my blood to this trial, and I can vouch for it being an excellent study. But I have a keen interest in the issues, and what I'm going to be talking about is best summed up with a headline I saw in the Journal of the American Medical Association recently, which said, what is the potential COVID-19 endgames? What are the potential COVID-19 endgames? And they gave four possibilities: eradication, no more COVID; elimination, not existent in some areas, but existent in others; cohabitation with the virus, or conflagration. So there are four possibilities that this article laid out. What I was doing, I'll be starting just talking about the cost to our society, physical, financial, and social costs very briefly. And then going to be talking about variants, because variants are going to be what's going to drive the future of COVID. And we've all come to understand that people who are unvaccinated are contributing to this problem, because every time the virus gets into a new subject and then reproduces, it can lead to a variant which could be more deadly. There's a new theory about an added source, which has recently come to my attention based on a unique case in the UK treated at Oxford University, where some guy with a history of lymphoma was secreting the virus for over 100 days. Inpatient at Oxford University for over 100 days, where his blood was constantly taken. He was having constant cultures. And I will be sharing with you some of the science that came out of this, which is really asking some key questions about how variants are produced. Brief history of mRNA vaccines, which is very important, and what new vaccines are on the chopping block. And booster shots, for example. I was in a Moderna trial just a few weeks ago as a follow-up subject. We're randomizing standard booster versus a designer booster, where the design booster is directed specifically at the Delta variant. But as we think about new vaccines, we also need to think about delivery. The problem that's occurring in developing countries is they don't have enough syringes and needles. And they're starting to reuse the syringes and needles, which has a risk of causing an HIV epidemic in some developing countries. So the new vaccines are looking at other delivery systems, such as nasal sprays, such as oral intakes. And so I'll be briefly mentioning that. And then another very, very important point is what new diagnostic techniques are on the horizon, which will allow us to do very rapid kind of assays as specific as the PCR test, which we currently have to wait for 24 hours. And then I will end by asking the question, are we prepared for the next pandemic? I think our institutions have failed us. I'm an alumni of the CDC, loved my year at the CDC. It's a great organization, but they clearly let us down. And I think the NIH has also had some failures. Now, we don't know where this virus specifically came from. The two prevalent theories are it came from an animal intermediary or was a lab accident at the Wuhan biosafety lab. I don't know which one it is. I think there is increasing evidence that it was a safety lab issue, and that was the Wuhan lab was a level 4 biosafety lab. We do not know in the United States how many level 4 labs there are. Let me say that again. We have no idea how many level 4 labs there are in the United States, and we certainly don't have any safety oversight of it. So whatever the theory of the origin of the virus, we need to seriously think about biosafety, and there have been examples of infectious disease epidemics or breakouts from accidents in the United States of biosafety labs before we start throwing lots of eggs at the Chinese Wuhan lab. And last but by no means least, I would just saying a few words about my pet peeve, which is why is there a separation between clinical medicine and public health? Surely every doctor should be trained in public health and think about preventing diseases in community. Why is this just the purview of the public health authorities? And how much clinical savvy do public health folks have about infectious disease or the real issues in the clinical world? So that's a pet peeve I have, and that's how I'm going to end up. And those are just the topics I'm going to be covering. Over to you, David.
Thank you so much, Ben. As you can see, I always love listening to Ben. I get smarter all the time about this. And I think that's a great segue, your pet peeve, to introducing another person is, let's see, Donna, are you up here? Are you on?
I am.
Okay, Dr. Donna Peterson, who is the head of public health at the University of South Florida, and is bringing the public health aspect. You might, so certainly talk about what you plan to talk about, but also, you know, sometime address what Ben was just saying is his pet peeve.
Well, like the previous speakers, I am honored to be here. I am delighted to be a part of this program. I am looking forward to doing it in person in December. Hopefully we can. That will be a nice sign that things are improving around us, though they may not.
Will you be the advisor to the Institute as to whether we should or shouldn't?
That's, as Karen will tell you, that's my job. I am scanning the horizon, finding people trying to have events and telling them no. That's my new job. But I love hearing Ben's comments, and I am honored to be on this program with him. I was going to provide just a little bit of background about what public health actually is, because most people don't know what it is, or they only know it from whatever encounter they may have had. I like to define it as what we do collectively to create conditions in which we all can be healthy. And that's what creates the problems, because we don't act collectively in this country around much of anything. As we just heard, part of our climate warming disturbance crisis catastrophe problem is that we don't see the need or understand how we can work in a collective way. And that absolutely plays out in public health. I've been in this field a long time, and I've lived through a number of the events that we hoped would change the public's perception of public health, change how we invest in public health, change how we create a workforce that is highly competent and confident and has the trust of the public. And I have watched all of those things fade away. When the immediate crisis is gone, it's very difficult to sustain that ability to invest. It's hard to invest in something that's not happening. It's hard to invest in something that may happen. Prevention is something everyone agrees to until you try to put in place those things that would enable us to prevent the disease that people then regret that they have acquired. So I'll come at it from that perspective, sort of what public health is, how we all need to engage in public health. And then I think some of what we've learned COVID, and hopefully what we learn going forward in a post-COVID world, though, as Dr. Sachs just said, I don't know that there will be a no COVID world. I think we will have to find ways to adapt to either a continuing COVID world or the next version of COVID. I like to remind the public whenever I have a chance to speak that every infectious disease you've ever heard of and all of the infectious diseases you've not heard of, except for smallpox, are still on the planet. And we have learned to coexist with them, and we manage them and control them. We use environmental means, we use engineering means, and ultimately the vaccines that have been developed over the years are our best defense. And because I think people have lost the understanding, because we've been so successful with vaccines, and people now have never seen someone with polio or measles or mumps or seen what destruction it can cause, then it's easy to say, well, why do I need a vaccine? Why do I need to vaccinate my child? And I think COVID has just really brought all of this to the fore. So that's the approach I'm going to take. And yes, Ben, I love what you have just said. I think we have to find better ways to reframe our entire health system so that it is a health system that includes what we do at the level of the community and the population and the individual patient. All of those things should be integrated and cohesive, and it starts with how we view our roles and the respect we have within our different health professions, and the way we train and the way we learn and the way we work together. So I look forward to this. Thanks, David.
Great. Dr. Peterson, a question for you, because I get asked these questions when I talk, I've said that I didn't think that COVID-19 was ever going to go away. I'm not sure which of the four that Ben said. I think it's going to be cohabitation. But is there going to be, like, as COVID-19 is named because it was 2019, is there going to be a COVID-26 or a COVID-27 or a COVID-24, another variation of the corona, do you think?
Well, I think, yeah, I would expect that COVID-19 was the original new version of coronavirus that was new to us, but now all the variations are just going to be the variations of COVID-19. I think we're more likely to see the whole 24 or the Eisenberg 25. I mean, I think it's more likely to be something new.
Yeah, okay. And that's a possibility that maybe.
Yes, both are possible. More variants to COVID-19 or something novel.
Okay. Hopefully you can address that, because I think that's a key issue that comes up, at least for people who are forward thinking. Do you want to have the pleasure of introducing your colleague?
I would
Dr.
love
Kevin
to.
Sneed?
So my dear friend and colleague, Dr. Kevin Sneed, who's Dean of our Tunasia College of Pharmacy at USF, also actually knows far more about vaccines and immunology than I ever will, and has been a very important and trusted partner in all of this, particularly in dealing with communities at higher risk, which are unfortunately in our surroundings, Black and Brown communities who have histories that make them less likely to get vaccines, make it harder for them to access healthcare, make them at higher risk for what infections like COVID-19 create. And Kevin has been working tirelessly in those communities, trying to help increase the rate of vaccines and reduce transmission and reduce severe illness and death. So Kevin is, we can talk about anything, I think. And so I look forward to hearing
Kevin,
what he anticipates talking about at this symposium.
Me too.
So
Go ahead,
Kevin.
Yeah.
Well, David, thank you very much. I'm very happy to be here with the Sarasota Institute, and I know we're running up against the time here, so I'll be very brief.
We're fine. We have up to 2 hours. You go ahead.
Yeah. Well, first of all, I just want to kind of riff off of both Dr. Sachs and Dr. Peterson, just in terms of the fact that the public health implications of everything that we're doing around COVID. We need to provide a much higher level of understanding and education to the public. To be perfectly honest, when I go out and I have now done 108 distinct and unique community education presentations, all on Zoom, on a Zoom platform, by the way. And I'm very excited that Dr. Sachs, for example, mentioned the fact that he's been participating with the mRNA vaccines, because that's going to be the future of how we defeat everything that we're doing. And before I go any further, David, I wanted to hold this book up. This is when you and I were introduced to each other back in 2010 and 2011, and I won't read the nice note you put in here for me, but you know, there's some language in there that you wrote. And the future of healthcare really does involve all 10 points that you have here. And when you go out and think about where we are with COVID-19, there's an implication for all 10 points that the Institute really talks about. And we need to highlight them. I think we need to start with climate. If you talk with real scientists around the world, I think we would all, and I happen to fall in this category as well, that climate really is at the epicenter, if you will, of the mutations that occurred, whether it happened to occur in nature and then was being studied in a lab or otherwise. Climate change is now creating very unnatural patterns for animals. It's creating very unnatural patterns for the vegetation that they feed on and depend on for life cycles. And so everything that you mentioned and everything that unfolds after that, when we begin to talk about the media and education, when we talk about technology, when we talk about all the components for healthy living of all populations, I intend to kind of provide a little bit of insight on where we are, where we can go. I spend a lot of time with other futurist groups around the country, and truly look forward to giving some insight, but even providing some, you know, maybe this is not the proper word, but it's the word that comes to mind right now, providing ammunition for all of the work that this great institute is going to achieve moving into the future. And then the very final thing I'm really hoping to accomplish is to spotlight really the stain and the stench of some of the health inequities that have existed not only here in our country, but around the world. And when I'm out talking in the public, one thing I've had to do now for several months is remind people that the Delta variant did not originate in our country. You know, and the fact that it migrated here really does show how small the world has become. And so we are no longer immune to the actions of another country or another part of the world, another part of the globe. We all have to kind of take a more systemic approach to health to protect ourselves here in our country, so that people in all communities can have an opportunity, at least have the opportunity for a fuller life. For, you know, that life, liberty, and pursuit of happiness that we hold on to so dearly here in the United States. And so I'm looking forward to a robust discussion around the vaccines. And Dr. Sachs, I just want David, just want to also share with you. My background is in microbiology and immunology. Before I went and got a doctorate of pharmacy, I was heading off to get a PhD, and I felt I just wanted more patient contact in that. But the coronavirus is not new. You know, it's estimated 10 to 15% of people that either had the flu or a common cold already had a version of a weakened coronavirus that had been around for a long period of time. And so I do believe moving into the future that we are going to have another pandemic. I don't necessarily at this point believe that pandemic will be another coronavirus. It could turn out to be another influenza. If you all are not familiar, they did find one individual with a H10N3 over in one of the Asian countries, and so it's not contagious. It's not going to spread around the world. It's not going to create a pandemic, but it's a reminder of exactly what Donna said in terms of every virus that has ever caused a pandemic and is now in some way, shape, or form either endemic or is still currently existing somewhere on this planet. And so we have to get used to the ways that we're going to protect ourselves, and the mRNA vaccines are really at just the beginning of our ability to be able to tap into the machinery of our body and turn and have our machinery begin to protect us in a way, even against whether it be cancer, viruses, bacteria, and other things. But we're going to have to educate the public. We're going to have to make them far more aware of the technologies moving forward. And so that's what I hope to contribute to the conversation, just to kind of round out the health equity component, the futuristic vaccination components around the technology that's continuing to evolve. And then the very final thing, and Dave, you have to give me 30 more seconds here, because I'm the dean of pharmacy, and when people think pharmacy, you think we're handing out medication across the counter at your local community pharmacy. But one difference, one thing that's really futuristic and different about the way that we're training people is that all of our graduates have some depth of understanding around the measurement and monitoring of that medication. And now we're working diligently to build platforms to be a better resource for not only physicians and prescribers, whether it be nurse practitioners or physician assistants, but to be a better resource for the patient, so that we can measure and monitor how effective those medications are, do it in real time, using biometrics to determine that, using AI in the background to inform us even better of who we need to put our efforts towards, and then putting that into a platform that becomes ubiquitous with the patient, so that they can drive their personal health record much more than the way we do it now, which is typically driven by the healthcare system having ownership. And so I just wanted to kind of let people know that it's because of institutes like this that people like me and Dr. Peterson have an opportunity to unlock the imagination and creativity of so many people to get to a different point in the future. But all 10 points that you have, as I reviewed them getting ready for today, all 10 points that you all have as a bullet point clearly at this point have a integral component of where we are with the current COVID-19 pandemic. And I'll pause there, but thank you very much for your time to allow me to come and present to you all.